Good evening. Kidney failure occurs when your kidney suddenly becomes unable to filter waste products from your blood. When your kidneys lose their filtering ability, dangerous levels of waste may accumulate and your blood's chemical makeup may get out of balance. To know more about kidney failure, dialysis, and kidney transplant, we have with us today Dr. Balasubramanian, nephrologist at Apollo Hospital's Greens Road, Chennai. Good evening, doctor.
Good evening.
What is renal failure?
Okay. Before we go about talking about kidney failure or renal failure, we should
I
know.
should be asking you about what are the normal functions of a kidney.
Yeah. We should know about the normal functions of the kidney. So the normal function of the kidney, number one, is purification of the blood. So where do we get the impurities from in the blood? So whatever we eat, the food, it gets digested and we get useful products and waste products. So the waste products get excreted through the kidneys. So the main function of the kidney is to excrete the waste products. Apart from that, kidney also plays a very important role in building up blood hemoglobin, and also it plays a very important role in bone strengthening by activating vitamin D. So these are the important functions of the kidney.
And what is renal failure?
Okay. So when the kidneys do not function normally, we measure the kidney function by a word called GFR. So like you have a height is being measured in meters, you have weight which is being measured in kilograms or grams, you have the kidney function which is being measured as what is called as glomerular filtration rate, GFR. Normally we expect that to be more than 90 ml per minute. So if the kidney function, the glomerular filtration rate starts reducing below 90, we start saying that the kidneys are slowly failing. So this is we call as kidney failure or renal failure. Renal is a technical term of kidneys. So I may use these words interchangeably. So it may be kidney failure or renal failure, both mean the same.
What are the types of renal failure?
Okay, so we divide the kidney failure broadly into two categories. One is called as acute renal failure. We call it technically as acute kidney injury. Other one variety is called as chronic kidney disease. So there are two types, acute kidney injury and chronic kidney disease. These are the two broad categories of kidney failure. Acute kidney injury means it's a kidney failure which has happened suddenly over few days or few weeks. And this is one variety where potentially the kidney function can become normal if we treat it. Chronic kidney disease is a disease process where it happens slowly over few months to few years. The kidney function irreversibly gets worse and it leads to a permanent loss of kidney function. So this is the two broad categories, acute kidney injury and chronic kidney injury. Acute kidney injury, as I said, is a recent kidney problem. Chronic kidney injury means it's a long-standing chronic kidney problem where the kidney function has been slowly getting worse. Acute kidney injury can become normal. Chronic kidney disease does not get back to normal. It's a permanent loss of kidney function.
Is kidney failure reversible?
As I said just a few minutes back, acute kidney injury is potentially reversible. You can cure acute kidney injury. So you must have heard people come and say, doctor, I had a relative who had kidney problem and he became completely normal, and now you're telling me that I have a kidney problem where it can't be cured and it is I have to go ahead and do things like transplant and all that. Then I'll have to explain them this entity that person whose kidney function has become normal probably had what I said earlier as acute kidney injury. If the person in front, what I am talking to has an irreversible permanent kidney failure where the kidney function will not become normal. So you have to be very clear about what type of kidney failure they have.
We have a question. It's been 12 years since my transplant and my creatinine level is now at 1.5. But sometimes it increases. What should I do? And post-transplant, when should I get a biopsy done?
Okay. See, to answer this question, we need to know whether this 1.5 has been there all the past 12 years, or has it gone up suddenly to 1.5? So if it has suddenly gone to 1.5, it means that there's some problem which has happened recently in the transplanted kidney. In that scenario, then we need to see what is the reason for the sudden increase in the creatinine. Creatinine is a waste product. So we measure the creatinine levels, and based on that, we try to calculate the kidney function. So what I mentioned as a GFR is calculated based on this blood creatinine levels. So as you said, 1.5 is above normal. So we would like to see whether this has happened suddenly or whether it's been the same all through your 12 years of your post-transplant period. If it's been the same all through, then probably you may not need anything more than that. But if it has suddenly gone up to 1.5, then we will have to see what is the reason for this sudden increase. We will do many tests to see the reason. One of it is a kidney biopsy. If we can't find out by any other means without a biopsy, then kidney biopsy becomes mandatory.
What are the causes of acute kidney injury?
Okay. So acute kidney injury, as I said, is a sudden onset of kidney failure. The common causes are diarrhea. So what is common in our country? You have patient develops cholera or profuse diarrhea. Water gets lost from the body. So vomiting, profound vomiting. So this is one of the important causes for acute kidney injury. Number two is many medicines can cause acute kidney injury. For example, painkillers, antibiotics. One important point I would like to say here is do not take any medication over the counter without a doctor's prescription. Each medicine has got potential good effect and a potential side effect. So you may not know the side effects. So there are a lot of over-the-counter medications, especially the painkillers, which can cause acute kidney injury. So this is cause number two. Third,
this is applicable even to normal.
Yes, it is. There are so many. Unfortunately, in our country, any medicine can be bought over the counter. That's just ideally there are medications which need to be dispensed only on a prescription, but you just go and ask the medical shop, ask them to give you any medication. They'll just give you a medication, painkiller, or there are a list of so many medications. You take them without a doctor's prescription, there are chances that you may land up having an acute kidney injury. Third important reason is sepsis. Sepsis means infection. You can have infection in any part of the body which spreads to the entire body. They can develop acute kidney also will get affected. So it's an acute kidney injury because of sepsis. So these are the most important causes of acute kidney injury, especially in our country.
What is chronic kidney disease and what causes CKDs?
Okay. Chronic kidney disease, as I said, is a slowly progressing, long-standing, irreversible kidney problem. So the kidney function slowly gets worse over a few months to few years. There's no cure for the chronic kidney disease. There are many diseases which can cause chronic kidney disease. The most important two diseases which can cause chronic kidney disease are, number one is diabetes. So diabetes is one of the most potential killer which can affect so many organs in the body, and kidney is one of them. So if you take 100 patients with chronic kidney disease, diabetes, 40% of the patients roughly have diabetes as an important cause of chronic kidney disease. The second important thing is high blood pressure. We call it hypertension. Poorly controlled high blood pressure can cause kidney damage. Apart from these two entities, there are certain diseases which run in families. It's a hereditary diseases like polycystic kidney disease and hereditary nephritis. There are so many other varieties which can cause chronic kidney disease. Any obstruction to the kidney or to the outflow of urine, we call it as obstructive uropathies, can also cause kidney failure. There are other entities which can affect various parts of the kidney. So, the important diseases which the public must know and which is potentially preventable is diabetes and high blood pressure. Other things are not under our control.
Hello, doctor. Can drinking excess water cause kidney failure?
No. This question, I have so many patients who read so many sources. I mean, WhatsApp and whatever it is. They have a concept that you drink a lot of water. I'm surprised to have this question because I generally have a question. Doctor, I drink 5 to 6 liters of water. Can prevent kidney failure? This is the question is generally asked. I'm surprised to have the opposite as a question. What should govern water intake is our thirst. So there's nothing, the water is not being prescribed. Okay, so if somebody is thirsty, they should have water. There's nothing called taking plenty of water or taking very less water. You feel thirsty, have water. Because taking too much water, people consider is flushes out the system and all that, should not be done. It may not cause harm in young people, but as they get older, the capacity to excrete excess water gets impaired, gets reduced. That has potential side effects. So please do not overdo anything. So I wouldn't recommend taking liters and liters of water just like medication. Just go by your thirst.
The person who asked us about the 1.5 level creatinine has asked again. Basically, after transplant, the doctors had prescribed tacrolimus and Celsep medicine, and it's been almost 12 years. Can I change the medication?
No. Do not change your medications without your doctor's consent, because we need to really see the, as I just said, we have to find out what is the reason for the rise in the creatinine. So that your nephrologist will evaluate and then will let you know. So do not tamper with those medications. They are very, very, very important. If you tamper with those medications, kidney can go for a rejection and the kidney will start failing and the creatinine will start increasing. So do not tamper with the medications without your doctor's prescription.
Speaking of renal failure, what are the symptoms of renal failure, doctor?
Okay. This is a very, very, very relevant question here. Before I talk about symptoms of renal failure, the public must know an important thing, that you can have kidney failure without symptoms. There's a large chunk of kidney failure which do not have symptoms until the kidney function comes below less than 20%. So the kidney will be slowly failing. They may not have any symptoms at all. So they'll think that they're perfectly normal. They develop symptoms very late and they come to the doctor with symptoms what I'm going to describe you. And then the doctor evaluates and says that, okay, you have chronic kidney disease. They'll be shocked. Doctor, I have been doing quite well. All these symptoms have been there in the last 1 month. How do you say that it's been there for many years? That's the sad part of it. You may not have symptoms pertaining to renal failure until it comes late. Okay, coming back to the symptoms related to renal failure: leg swelling, passing frothy urine, which means that protein is leaking in the urine, passing blood in the urine, or as I said, if somebody has long-standing diabetes or high blood pressure, even if they don't have symptoms, they have to go for a routine annual checkup to see whether the kidneys are being affected. Reduction in the volume of urine. These are all certain symptoms which can point out to kidney disease. Then progressive reduction in appetite, vomiting, breathlessness while walking. All these also can be part of symptoms related to kidney failure. Excessive fatigue. As I said, kidney is an important organ which helps in formation of hemoglobin. So if the kidney starts failing in CKD, hemoglobin production will come down. So they become anemic. So the anemia will cause a lot of tiredness. So if you have unexplained tiredness, that also can point out to a cause. I'm not saying that all tiredness is because of kidney failure. This is one of the symptoms of kidney failure. So you have other reasons for having loss of appetite and all that, but I'm just trying to tell you that these are all certain symptoms which can come in kidney failure. So somebody doesn't have an appetite doesn't mean that it always means a kidney failure, but one of the symptoms of kidney failure can be this.
So what are the tests that are done for diagnosing kidney failure, doctor?
Okay. you have certain blood tests, you have urine tests, you have ultrasound. In the blood test, we do blood urea, we do serum creatinine. These two tests will help us to tell the kidney functions. Apart from that, we check the hemoglobin, we check the electrolytes like sodium and potassium. Then we look at the urine, we look for protein in the urine, we see for blood cells in the urine, red blood cells in the urine. Then we do an ultrasound. Ultrasound can give give us information about how the kidneys look, whether the kidney is shrunken. If you have small kidneys, shrunken kidneys, it means that it is a chronic kidney disease, which means that the kidneys have been slowly getting affected. Whether you have symptoms or not, it means that it could be a chronic kidney disease. So these are the preliminary investigations that can help us to diagnose kidney failure.
And what is dialysis, doctor?
Okay. Before we come to dialysis, we'll have to say that now we have spoken about the types of kidney diseases. We spoke about the symptoms of kidney disease. Then we said about the important causes of kidney failure. Now we come to the treatment part. So if it's an acute kidney injury, you try to correct the cause of the acute kidney injury. For example, if somebody had vomiting and diarrhea and water loss from the body, you try to give them fluids, you try to control the diarrhea. If somebody has sepsis, infection, we give antibiotics, cure the infection. And if somebody is taking any unwanted medications, we try to stop the medications. So by trying to treat the basic cause of acute kidney injury, you allow the kidneys to heal, the kidney function will become normal. Okay. If the kidney function starts going down from 90% down to 80, 70, 60, 40, 30, 20, and less than 15%, what happens is the toxic waste products start accumulating in the blood. I just mentioned blood urea and creatinine. The levels start going to very dangerous levels in the blood. At that point, you cannot manage them medically. So the potassium levels will start going high. The acid levels in the blood will start going high. So at that particular point where you cannot manage them by medicines, the only way is to artificially purify the blood. So this artificial method of purifying blood of the impurities is called as dialysis. So dialysis is a method where we take the blood out, or not necessary, we purify the blood of the impurities or the toxic waste products.
And when is one suggested to undergo dialysis, doctor?
Okay, so as I said, just mentioned, if the kidney function is not too bad, or the GFR is not too bad, we don't straight away dialyze them. If the kidney function goes, say, less than 15% of normal, or it goes below 10% of normal, where all the toxic materials start accumulating in the blood, that is the time when we suggest dialysis. Mind you, dialysis is a treatment that can be given for acute kidney injury and also for chronic kidney injury. And dialysis will be temporary in acute kidney injury, which means that if the kidney function gets back to normal in case of acute kidney injury, we will be able to stop dialysis. If it's a chronic kidney disease, where as I said, it's a permanent kidney failure, dialysis becomes a permanent treatment unless they go for a kidney transplant. So when somebody says he's on dialysis, not necessarily means that it is a permanent kidney failure. We do dialysis even for acute kidney injury until the time that something is being done to reverse the kidney function back to normal in acute kidney injury.
Coming back to our questions. Hello, doctor. After transplant, which type of foods helps maintain lower creatinine levels?
We have not finished with the dialysis.
Sorry, which was one of the questions that had come in, so I just
asked. After transplant, if the kidney function is normal, you can go for a normal diet. Unless they have diabetes, then they have to go for diabetic restrictions. So there will be no special restriction in the diet from the kidney point of view, because kidneys are functioning normally after transplant. They can go for normal food, but of course, calorie restriction to prevent weight gain, low fat and low cholesterol diet, low salt diet, obviously, because most of them will have high blood pressure. So obviously, they're supposed to have low salt diet, not zero salt, low salt diet. So this is what will be the diet in a patient who has had a successful transplant. Other important thing about the diet is the hygiene point of the food is very important after transplant, because the body is immunosuppressed. If you take unhygienic food, they can get infection through the food or water. So what is very important is they must eat hygienic, clean food. Eating out or unclean food, unsafe food can cause diarrhea and infections through food or water. That is one thing that they have to be careful.
Coming back to dialysis,
Yeah.
what are the types of dialysis, doctor?
Okay. There are broadly two types of dialysis. One is called as hemodialysis. Other one is called as peritoneal dialysis. Hemodialysis is a dialysis where we take the blood out from the patient's body through a tube, and it is run through an artificial kidney on a machine, and that artificial kidney or the filter, we call it as a dialyzer, that filters out the toxins and sends back the purified blood to the patient's body. So this is called as hemodialysis. This hemodialysis is generally done in a hospital setting. There are in foreign countries, there are also home hemodialysis techniques where patients do hemodialysis even at home. But most of the, we don't have home hemodialysis in our country. I should use the word we don't have. It's very, very, very unusual to have someone have a setup of a hemodialysis at home. So generally hemodialysis is done in the hospital. So patients go from their homes to the hospital dialysis center 2 times a week or 3 times a week. They do this process of hemodialysis. This is called as hemodialysis. The other type of dialysis is called as peritoneal dialysis. Peritoneal dialysis is another type of dialysis where this is also a blood purification technique. What we do is we put in a catheter, small tube inside the abdomen, and solutions are available in containers. Those clean solutions are is being run through the tube inside the abdomen cavity, kept for few hours. Doing this purifies the blood of the impurities, and after some time we let that fluid out. By this process, the blood gets purified. So this technique can be done at home, but every day patient has to use 3 or 4 bags of that solution, and it has to be done on a daily basis. So this technique is called as peritoneal dialysis. This can be done at home. They'll be trained by the technicians or the doctors in the hospital as to how to do it at home. After having learnt it, the patient or their relatives or the caregivers can do this peritoneal dialysis at home.
What are the problems associated with dialysis, or what are the complications associated with dialysis?
Okay. Hemodialysis, the main problem is they can get infection if they have catheters. So to prevent that infection, we generally ask them to go for what is called as a AV fistula. There's a small procedure in the hand which makes their veins big, so that we put the needle inside the veins. So if they don't have the fistula, they go for dialysis through tubes. We call it as catheters. We insert it in the neck. They can get infected. They can get fever. That is one important thing. Number 2 is hemodialysis patients, if they have other organ problems, mainly heart problems, if the heart pumping is very weak, they generally may not tolerate hemodialysis. So they develop low blood pressure. Some of them may even crash during hemodialysis. Otherwise, hemodialysis is a very effective modality. We have so many patients who are having a wonderful quality of life for 10-15 years on hemodialysis, dialyzing 2 to 3 times per week. So that is about hemodialysis. The other peritoneal dialysis, the most important complication what can happen is the solution, I said they put it into the abdomen cavity through the catheter, and it is done at home. Strict clean practices have to be followed. If there is any breach in the cleanliness of doing this technique, the fluid can get infected. They develop what is called as peritonitis. The fluid which goes inside the abdomen will get infected. They'll get abdomen pain. and the fluid becomes like something like a cloudy fluid, and they have to rush to the hospital for treating that infection. So this is one of the important complications of peritoneal dialysis.
How is kidney transplant done or performed?
Okay. Kidney transplant is a process where there's a donor who donates one of his kidneys. This is again a question what the patient who comes asks me is, have both my kidneys failed? So the answer is yes. Kidney failure going for dialysis or transplant, which means that both the kidneys have failed. So then the next step I said transplant. The next question they ask is, do we need two kidneys for replacing or just one kidney? Obviously, nobody can give two kidneys, and the donor can't be alive if they donate both the kidneys. So obviously, if one good kidney comes to the patient from a donor, that is enough. So there must be a donor who is willing to donate the kidney. If you have a blood-related donor, there will be a good match, what we call it as a tissue match. If you have a good matched kidney, the chances of that kidney working well is very good. So that kidney is taken out from the donor by a surgery, and then it's put inside the patient, the kidney failure patient's abdomen is being opened, and the kidney is attached to the patient's arteries. And that kidney starts working like his own kidney, and it starts doing the purification function. So this is called as transplantation.
Who is eligible for kidney transplant, number one, and what are the criteria to be met for donors as well?
Okay. Transplant, when the question comes about transplant, I generally give an example of a car which is run for say 15 years or 20 years. Kidney, you can allude kidney to the tires. So you just transplant, it's not just a question of just putting in a new tire of an old car. If you want the car to run well, it's not just a question of changing the tire. You need the engine must be in a good condition, the brake must be in a good condition, and all the other parts of the car must be in a good condition. That's the same thing which I try to tell the patient. Every other organ, say the liver, the heart, and every other organ must be functioning well. So we generally send them for checking the position of the other organs to make sure that they are all reasonably doing well. Because if the heart is very weak and if the patient is not going to do well because of the heart, just putting in a new kidney may not prolong their lives. So we generally do tests to see whether other organs are working well. Then we tell them that they're eligible for a transplant. That's in brief about who is eligible for it. So this transplant is done only for CKD. As I said, acute kidney injury patients, if the kidney function becomes normal, they will be able to stop the dialysis. There are certain acute kidney injuries, if they can't be cured, they'll automatically get converted into CKD. So those CKD, which means that it is an irreversible permanent kidney failure. Transplant is recommended only for CKD, not for acute kidney injuries. So if the patient gets back normal kidney function, either by themselves, automatically or by some medications, they won't need dialysis and transplant lifelong. If the kidneys don't recover, or if they have a CKD, then they will need transplant. So CKD patients whose other organs are working well, we tell them that they're fit for transplant. And the donor, we look at donors generally between 18 years to 60 years. Why above 18? Obviously, 18 years and below, they're all children. 18 years is an adult where you have reasonably a good function of all the organs. 60 years and above, each organ starts functioning below its normal levels. So generally, we do not encourage very old donors unless they are really fit and every organ is working very well and the kidneys are working very well even at 65 or 63. Then probably we may give an exception and we can accept a little elderly donors. But generally, it's better to go for younger donors. And the donor should not have diabetes or blood pressure. As I said, number one cause of kidney failure is diabetes. Number 2 is high blood pressure. So if a patient already has, a donor already has a diabetes or hypertension, he himself is prone to get CKD in the future. So if he donates one kidney, you're putting him at a higher risk of developing a CKD in the future. So we do not accept diabetics and hypertensives. And other important thing is the blood group. We want the same group of the patient, recipient, or the donor can have O group. Positive and negative doesn't matter. So it must be that if the kidney failure patient is say B positive, the donors can be B or O. Positive and negative doesn't matter. So blood group should be matching. Diabetes should not be there. High blood pressure should not be there. 18 years to 60 years would be a preferable age limit. Matched kidney, which would mean if they are relatives, then they'll have a good match. So matched kidneys would generally perform well. So these are the criteria for somebody to donate a kidney.
Apart from all this, the blood pressure, the diabetes checks that are being done, are there any specific tests that are being performed before a transplant is done?
Is it for the recipient or the donor?
Both.
Okay, for the recipient, as I said, we look at heart. Sometimes we do a heart pumping echo. We do heart angiogram for the heart to see whether there are any blocks in the heart. We look at the blood supply of the inside abdomen, because we're going to attach the kidney to the blood vessels in the abdomen. So we look at whether they are all good. If there are no blocks anywhere, they see whether they had any stroke before. So these are the preliminary, and then we look at the liver function test. We look at whether they have any hepatitis B or hepatitis C viruses, because these are, if then we see whether they have any active infection, because after transplant, because of the medicines what they'll be taking, they'll be prone for getting infection. So we don't want them to have a transplant with an infection. So we would like to get rid of the infection before they go for a transplant. So this is a test which we run on the recipient. That's the patient with kidney failure. So for the donors, we try to assess the GFR. We do blood tests and urine tests to see the function of the kidney. Then we look at imaging. We look at we do an angiogram and we do a CT scan to see how the kidney looks. Then we also assess whether they're fit for anesthesia. We look for diabetes. Then we look for high blood pressure, obviously, as I said. Then we look at the heart and all that. And then after all the tests are okay, then we accept them as a donor and go ahead with the transplant. And again, an important point here, there is a huge gap between the availability of donors and the number of patients who are on dialysis. So the gap can be bridged only by what we call as cadaver transplant. Cadaver transplant is the donation comes from the relatives of patients who are brain dead. So there are patients, they meet with accidents, they get head injury, they get brain dead, they're not going to survive. So once the doctors declare them to be brain dead, by just taking off the ventilator, they're going to just die. So there have been so many families, even at the time of their grief, they have a good will to donate their close relatives' organs for donation. Like you would have heard about eye donation, but it's not just enough to donate eyes. If the brain dead patient's other organs are working well, heart, kidney, liver, pancreas, all these organs can be donated. It can lungs. So one brain dead patient can make something like 6 to 8 other patients' life better. You can give life to 7 or 8 other patients by donating all the organs. So this is another important message. The awareness about organ donation also is very important as a part of this telecast.
We have a question. Is it necessary that the donor and the recipient must be related?
As I said, if they are related, they'll have a better tissue match. The chances of rejection will be less. So the chances of the organ working well will be better. I'm not saying that unrelated persons cannot donate. Yeah, they can donate, but there are the chances of rejection would be higher if it comes from an unrelated donor, because they are obviously not tissue matched.
Can we lead a normal life post-transplant?
Yes, definitely. The quality of life is definitely much better after a successful transplant rather than to let them live on dialysis lifelong. If they are fit for transplant, definitely, especially young patients, must be offered a chance of having a transplant.
What is the recovery time after transplant, doctor?
See, generally they're kept in the hospital for a week, uh, and then if they're fit, they'll be discharged. Maximum by 1 month or so, they should be back fit enough to go back to their work, unless they have other problems. If they don't have any problems, everything is fine, they can get back to work by 1 month.
And with respect to their food habits, lifestyle?
I just mentioned just now, normal food. You don't have any more restrictions in the diet like a dialysis patient. Once the organ is, they get a kidney transplant and the kidney is working well, they won't need any special diet except, I said, clean food. No specific diet is recommended. Of course, low salt diet or diabetic diet and all that is recommended, but nothing specific for a transplant patient.
What are the benefits of kidney transplant?
As I said, dialysis is a recurrent process. Means you have, so the patient whose kidneys are permanently failed, CKD, has to have good quality dialysis, would mean 3 times a week dialysis. So he'll need to be on dialysis lifelong. So you calculate the expense, a good quality of dialysis and blood tests and all that would easily come something like 30 to 40,000 per month. So you multiply it by 12 and you multiply it by the number of years he's going to be on dialysis. Definitely the cost would be much lesser if they go for a transplant. If they have a transplant, say the cost, there's a question on cost also. The cost of the transplant would come somewhere close to 6 to 7 lakhs, including the workup for the transplant recipient and the donor, and surgery expense for both of them, excluding the medications. They would need to take the donor doesn't need to take any medications, but the recipient has to take medications worth 15,000 per month, and that will come down to say 10,000 or 8,000 per month after 6 months to a year. So you can calculate the huge cost saving by having a transplant. A successful transplant saves money. Number two is the quality of life. So imagine a patient on dialysis, like going to an office, he has to go to a hemodialysis center 3 times a week, stay there for 4 hours or 5 hours, three times a week and have dialysis. But if you have a good working kidney after transplant, they don't have to, they can lead a normal life. So obviously the quality of life would be definitely better with a good successful transplant. There will be no food restrictions for a transplanted patient. Obviously they will have, but the dialysis patients will have a lot of restrictions in the food habits. So the energy level and the performance in everything definitely would be definitely much better with a successful transplant. So these are the benefits of having a transplant, successful transplant over a dialysis.
Does life of a donor change post-transplant?
Yeah. So I said we do not just like that accept anybody as a donor. We do run so many tests to ensure that the chances of them developing a kidney failure in the future is what we try to assess. We try to eliminate diabetes, high blood pressure. We try to see whether they themselves have any kidney failure. So we exclude all of them, and once we think that they're medically fit and donate a kidney, they are as good as any other normal person with 2 kidneys. One good functioning kidney is good enough to keep their lives going. So a donor will lead a normal life even after donating a kidney.
What are the complications of kidney transplantation, doctor?
Okay. The kidney may not work because of some reasons. Number one is rejection. As I said, any foreign body which is being put into a body, the immunity of our body will reject that foreign body. So it's the kidney, which even it comes from a relative, it doesn't belong to us. So our body will mount a immune response to try to reject damaged gut kidney. So rejection is one of the important causes. So the kidney may not work because of rejection. Number two is the second important complication is the medicine. We try to prevent rejection by giving medications which are called as immunosuppressants. Somebody asked a question sometime back: tacrolimus and mycophenolate and steroids. So these medications are called immunosuppressants. We suppress the body's immunity to prevent rejection. So the side effect of these medications would be you suppress the body's immunity. Obviously, we will be prone to get infections. So patients who have had a transplant while on these medications may get infections which may be mild, or sometimes it can be life threatening. So they can have infection anywhere, lung or kidney, brain, any part of the body can have an infection because of immunosuppression. So these are the two important things which we worry about, the complications of transplant. There are many other things like medications related to the medication related side effects, like steroid obviously will make them fat. Because of steroid itself they can develop diabetes. This tacrolimus itself can cause kidney problems. Tacrolimus can cause diabetes. So there are some side effects related to the immunosuppressive medications themselves. But if you want me to list the two important complications of transplant, one would be a rejection, which makes the kidneys fail. Number two would be an infection because of the immunosuppressive medications.
We have a question on matches between donors and recipients that are made apart from just the blood group and general fitness. I'm sure doctor has already responded to that in detail.
Yeah.
If you can have a look at the video that is going to be telecasted post this FB Live session, you can have a detailed response to that, Ms. Prashanti. The basic question, doctor, how do you prevent a kidney disease?
Okay. I would say this would be the take-home message for this telecast, because 40,000 per month, or considering a transplant of spending 7 lakh rupees and medication of 10,000 or 15,000 per month, plus any other extra complications and hospitalizations which have not been included, you add up, the amount is enormous. The majority of Indian population, why talk about Indian population, even the world population or the rich countries cannot really afford the treatment for CKD, be it dialysis or transplant. So prevention is better than cure. So ounce of prevention is better than whatever the proverb is better than cure. So it's better to prevent CKD rather than to go for treatment for CKD. So how do you prevent CKD? As I said, the two important causes of CKD would be diabetes and high blood pressure. So if somebody keeps a healthy lifestyle, food habits to prevent diabetes and hypertension, they escape. There's a 60 to 70% chance that they will not develop CKD. Unfortunately, if somebody has diabetes and hypertension already, they should keep their diabetes and hypertension under very strict control right from the time it is diagnosed. If they keep these two diseases under control, the chances of them developing a CKD, chronic kidney disease, becomes very small. So these are two preventable diseases which cause kidney disease. So our country definitely needs more education towards prevention, lifestyle changes, healthy lifestyle, change in food habits, exercises to keep away from diabetes and hypertension, because diabetes and hypertension not only cause kidney problems, they can cause heart problems, stroke, heart attacks, vision is being lost because of diabetes, legs get amputated because of diabetes. So it's such a deadly disease. If you prevent diabetes or treat diabetes and keep the diabetes under control, you can prevent so many diseases which come as a complication of diabetes. So control of diabetes and hypertension are the key to prevent chronic kidney disease.
Sorry, we'll just take one last question, doctor. Is thyroid also a reason for kidney failure?
Thyroid, hypothyroidism or less functioning thyroid can reduce the GFR. I won't say it is a direct cause of kidney failure. I would not like to directly equate thyroid to kidney, but medically there is a link between reduction in the GFR related to reduction in the function of the thyroid, but don't take that as an important cause of kidney failure.
Thank you very much for a wonderful and informative session on dialysis and transplantation, Doctor. For appointments with Dr. Balasubramanian, you may contact 2829-6594. I repeat, 044-2829-6594. Thank you very much, Doctor, and thank you very much, viewers.
Thank you for this wonderful opportunity. Thank you.